everyone, my name is Mackie. I work with Northreach Society, and I'm here today to talk to you about sexual health. So before we get started, I just wanted to talk a little bit about some of the services that Northreach offers. So those include harm reduction, trauma-informed care, support, referrals, community outreach, education, and the take-home naloxone program, which is essentially the antidote to an opiate overdose. And all of our services are 100% free and confidential. So our mission statement is to address the social determinants of health through innovation, collaboration, education, support, and harm reduction. And our vision is a safe and inclusive world free of discrimination. So I wanted to talk a little bit about self-breast exams. A self-breast exam is a checkup that a person does at home to look for changes or problems in the breast tissue. Your goal is to get used to the look and feel of your breasts, and this will help you find anything new or different. If you do, call your healthcare provider right away. So I have a quick video here that will show you how to do a self-breast exam. Now it's important for both men and women to do self-breast exams because men also have breast tissue. A lot of times when men are diagnosed with breast cancer, it's in the later stages because they're not doing self-breast exams. So it's very important for both men and women to do self-breast exams.
Hi, I'm Dr. Laura Cooper, one of the breast surgeons at City of Hope. Today I'm going to talk to you about self-breast examination. Around 8 out of 10 women detect breast cancers or breast lumps themselves. Therefore, it's important that every woman understand the basics of a self-breast examination. There are actually two components, look and feel. For the first part of the exam, looking, you want to stand or sit in front of a mirror. With your clothes off, you want to look at both breasts to see if there are any differences between the two. Examine the nipples to see if there's any difference between the two. Is one redder than the other? Is one pulling in? Then you want to put your hands on your hips and turn from side to side to see if there are any changes. While standing, you actually want to put your arms forward on your hips because this will bring out lumps that might not appear otherwise. It's important to raise both arms above the head. This will draw out any puckering or dimpling for masses that might be underneath the nipple. If you're standing like this and you have a mass that's kind of in the lower part, you might not see it at all. But when you raise your arms, what happens is that mass kind of stays and then the skin kind of pulls in as you're pulling up. That was the first part of the examination. For the second part, you want to be lying down. You want to put your head on a pillow to prop yourself up and place one arm behind your head. Then with your other hand, you want to use your first 3 fingers. When you use only 1 finger or 2 fingers, you can actually separate the breast tissue and think that you feel something that isn't there. You can do this one of 2 ways. You can either go in a circular motion all the way around the breast, making sure that you overlap every area, or you can go up, down, all the way across. I prefer the circular motion, from the collarbone to the sternum or mid-chest, below the breast, and then all the way actually out into the underarm. Lymph nodes are underneath the underarm, and sometimes those can become bigger. When you're doing the breast examination, you're looking for things that feel different from the surrounding tissue. What you're looking for is something that stands out, something that feels like a pea or a marble or a walnut. You want to make sure that you do this examination at the same time each month. Remember, the most important thing about a breast self-examination is to know your breast. That way you can note any changes and alert your doctor.
So here I have a quick video about consent.
Consent is a pretty simple concept. Say you want to make plans with a friend. Like invite them over to your house, take them to a movie, or go for ice cream. Before you can do this, you need to check to make sure they're cool with it, right? Same goes for sex. Before you start any sexual activity with someone, you need to make sure they understand and agree to participate in that sexual activity. Sexual activity includes kissing, touching, and sexual intercourse of any kind. So, what does consent look like? Consent is asking the other person for permission before you start any sexual activity. Consent is a verbal, voluntary yes, with everyone agreeing to the activity. And and consent is done in person before the act and part of an ongoing conversation. Consent can also depend on how old you and the other person are. So take a moment to read this chart and make sure you understand the close-in age consent laws and how they apply to each group. It's also important to know if someone is drunk, high, or asleep, they cannot give consent. Pressuring someone into sexual activity does not mean you have consent. And not hearing a no does not mean you have consent. Be sure to pay attention to body language. Even if the other person verbally says yes, if their body language says no, you do not have consent. So how do you get consent? You ask for it. You say, "Is this okay with you?" Or, "Do you want to do this?" It might feel a bit awkward, but it's important to respect the other person's boundaries. Always ask for consent, and always respect the answer. And how do you give consent? You clearly agree by saying yes, or using another positive statement like, "Sure, let's do this." So remember, yes means consent, and it's always okay to say no. You can also change your mind at any time. So even if you say yes, if at any point you start to feel uncomfortable, you can withdraw consent and say no. And no always means no. Sex without consent is sexual assault, and that is not cool. But communicating with the other person every time you take part in sexual activity and every time you change the type of sexual activity is cool. So always ask the question. Keep asking the question and respect the answer. And always make sure you and the other person both understand and agree to what you're doing. If you have any other questions about consent, be sure to talk to your parent, teacher, or a trusted adult.
A few facts to take away from that video is consent is not a guessing game. It's either a yes or no answer. If you're under the influence, you cannot give consent, even if both parties are under the influence. It's okay to change your mind, and consent does not count if you've been forced to say yes. If consent is given in the past, it does not mean that consent is given now. And all sexual activity without consent is sexual assault and a criminal offense. If you're still having a little bit of issues understanding consent, here's another great video that really gets the point across.
If you're still struggling with consent, just imagine instead of initiating sex, you're making them a cup of tea. You say, "Hey, would you like a cup of tea?" And they go, "Oh my God, I would love a cup of tea, thank you." Then you know they want a cup of tea. If you say, "Hey, would you like a cup of tea?" And they're like, I'm not really sure. Then you can make them a cup of tea, or not, but be aware that they might not drink it. And if they don't drink it, then, and this is the important bit, don't make them drink it. Just because you made it doesn't mean you're entitled to watch them drink it. And if they say, "No thank you," then don't make them tea at all. Just don't make them tea. Don't make them drink tea. Don't get annoyed at them for not wanting tea. They just don't want tea, okay? They might say, "Yes, please, that's kind of you." And then when the tea arrives, they actually don't want the tea at all. Sure, that's kind of annoying as you've gone to all the effort of making the tea, but they remain under no obligation to drink the tea. They did want tea, now they don't. Some people change their mind in the time it takes to boil the kettle, brew the tea, and add the milk. And it's okay for people to change their mind, and you are still not entitled to watch them drink it. And if they're unconscious, don't make them tea. Unconscious people don't want tea, and they can't answer the question, "Do you want tea?" because they're unconscious. Okay, maybe they were conscious when you asked them if they wanted tea, and they said yes, but in the time it took you to boil the kettle or brew the tea and add the milk, they are now unconscious. You should just put the tea down. Make sure the unconscious person is safe. And this is the important part again. Don't make them drink the tea. They said yes then, sure, but unconscious people don't want tea. If someone said yes to tea, started drinking it, and then passed out before they'd finished it, don't keep on pouring it down their throat. Take the tea away. Make sure they are safe, because unconscious people don't want tea. Trust me on this. If someone said yes to tea around your house last Saturday, that doesn't mean they want you to make them tea all the time. They don't want you to come around to their place unexpectedly and make them tea and force them to drink it, going, "But you wanted tea last week," or to wake up to find you pouring tea down their throat going, "But you wanted tea last night." If you can understand how completely ludicrous it is to force people to have tea when they don't want tea, and you are able to understand when people don't want tea, then how hard is it to understand when it comes to sex? Whether it's tea or sex, consent is everything. And on that note, I'm going to make myself a cup of tea.
So, any form of sexual activity can include some risks. Those risks include HIV, unplanned pregnancy, and STIs. The only way to be completely risk-free is to practice abstinence. Abstinence is restraining from any intimate sexual behavior involving skin-to-skin contact, genital-to-genital contact, or genital-to-body fluid contact. It's the only 100% risk-free sexual activity. Here are a few things to ask yourself and think about before having sex. Now, you don't have to answer yes to every single one of these questions, but they are good to think about beforehand. What are my reasons for wanting to have sex? Am I lonely? Am I being pressured? Do I trust my partner? Do I love my partner? Will my morals, personal, or family values be affected? Will I feel guilty or bad afterwards? How will I protect myself from unplanned pregnancy and STIs? Do I feel comfortable enough to talk about preventative measures and boundaries? If I get pregnant or my partner gets pregnant, are we both ready to sit down and discuss our options? These are all great things to think about beforehand. So let's dive right in now and talk about safer sex. Sex means different things to different people, and it's a completely healthy and natural activity if engaged in by physically and emotionally prepared, well-informed, and consenting people. Whether you're straight, gay, lesbian, bisexual, transgender, queer, or questioning, you have the right to decide what sex means to you. So what is sexual activity? It's any activity done to yourself or with another person that's considered sexual. So I have a few examples here: vaginal sex, anal sex, masturbation, hugging, kissing, oral sex, pictures, touching, but there is so much more. What does sexual health mean? Well, it means feeling comfortable and safe whenever you engage in sexual activity. It means being able to talk openly about sex and the consequences that come along with it. It means being educated on how to be safe and what to do in the case of unplanned pregnancy or STIs. And most importantly, sexual health means respecting your decisions and values as well as your partner's. No matter your gender or sexual orientation, sexual health is important. So if you decide to have sex, choose safer sex. Here are some important things to remember when choosing safer sex. Communication. Talk to your partner. Discuss your options with them if you were to have an unplanned pregnancy or STI. Protection. Know how to protect yourself and know where to get this protection. Limit your partners. Ensure that you trust and care about your partners and they trust and care about you as well. And resources. Know where to turn in the case of unplanned pregnancy or STIs. So here are 4 different types of protection. Now, all 4 of these types of protection can help prevent unplanned pregnancy. However, only 3 of these types of protection can help prevent STIs. Those 3 would be the internal condom, the dental dam, and the external condom. So here I have a few demonstrations for you. Now, those videos are great to show you the different types of lubrication as well as how to use different types of condoms. So we're going to dive right into sexually transmitted infections. What is an STI? A sexually transmitted infection is an infection that is passed from one person to another through sexual contact. They can be passed through infected body fluids such as semen, vaginal fluids, and blood. They can be passed on through contact of infected mucous membranes as well, such as mouth sores. So even if you're sharing a cigarette with somebody who has a cut lip and a sexually transmitted infection, they may not even know, you could easily contract that as well. STIs can be viruses, bacteria, or parasites. Can anybody think of any examples? If not, that's okay. I have a few right here. So genital warts, genital herpes, HIV, hepatitis, gonorrhea, syphilis, and chlamydia. Now there are many, many more, but these are just a few of the most common that we're seeing today. So today I wanted to talk to you about the 3 most common STIs. So we're going to start off with chlamydia. Now, the majority of cases of chlamydia are from individuals between the ages of 15 and 24. It can affect the cervix, urethra, and occasionally the rectum, throat, and eyes. It can create another STI known as venereal disease, which can cause ulcers and bumps in and around the genital area. And it can be transmitted vertically, which is from mother to baby through childbirth. Symptoms differ from men and women. About 70% of women and 50% of men show no symptoms whatsoever. However, it is much worse in women than it is in men, which I find quite strange considering a larger population of women show no symptoms. So here you'll see a lovely picture of a throat that has been infected with chlamydia. So now we're going to talk about gonorrhea. Gonorrhea is on the rise in Canada. If symptoms do occur, they may not appear for 2 to 7 days after initial exposure. It can cause arthritis, infertility, or severe infection in the blood. And anyone treated for gonorrhea should be retested 6 months afterwards to ensure that the treatment did work. It's also important to note that oftentimes gonorrhea can be a co-occurring infection with chlamydia. And in this picture here, you will see an eye, actually 2 eyes, that have been infected with gonorrhea. Now we're going to talk about syphilis. Syphilis used to be an uncommon infection in Canada, but there's been an increase in both adult and congenital syphilis in many communities. Congenital means when a baby is born with it. Syphilis can progress through 4 stages, and we're going to talk about those stages now. So first, there's the primary stage. This can occur between 3 days and 3 months after exposure. A typical symptom of primary syphilis is canker-type sores. Now, these sores may disappear on their own, but that does not mean that the individual is no longer infected or contagious. And then we move on to secondary syphilis. This can occur between 6 weeks to 6 months after exposure. Some symptoms of this stage are wart-like lesions, as well as a pink or brown rash around the body, typically on the palms of the hands or soles of the feet. Now again, these symptoms may go away on their own, but that does not mean that the individual is no longer contagious or infected. And then we move on to latent syphilis. This typically occurs about 1 year after exposure, and in this stage there are no symptoms whatsoever. However, the bacteria is rapidly multiplying. And then finally, the last stage is tertiary syphilis. Now this can occur between 2 to 30 or more years after initial exposure. In this stage, syphilis can affect the heart, blood, liver, skin, and nervous system, and symptoms depend on the part of the body that is being affected. Here in these pictures, you will see a tongue with a canker-like sore, as well as a hand, palm of the hand with the rash. And breaking news, Alberta is in the middle of a syphilis outbreak. So if you are in need of protection, please contact us and we can supply you with both external condoms and internal condoms, as well as dental dams. Please call us at 1-587-202-0997. So some common symptoms of an STI. As we discussed before, sometimes there is no symptoms at all. There could be an unusual discharge or odor, abdominal pain or genital pain, swelling in the genital area, burning when urinating, spotting between periods, or tingling or itching in the genital area, sores or bumps in and around the genital area, sore throat after oral sex, or flu-like symptoms such as fever, nausea, fatigue, and weight loss. I also wanted to discuss vaginal discharge. Vaginal discharge is fluid made by glands inside the vagina and cervix. It carries away dead cells and bacteria, and this keeps the vagina clean and helps prevent infection. Most of the time, vaginal discharge is perfectly normal. The amount can vary, and so can the odor and color, depending on the time of your menstrual cycle. However, if the color, smell, or consistency seem quite different than usual, especially if you have vaginal itching or burning, you could be dealing with an infection or other condition. And it's important to notify your healthcare provider as soon as you can. So if I thought I had an STI, I would A, get tested, and B, tell my partner so they can get tested as well. And if I were to test positive for an STI, well, I wouldn't worry. Most common STIs are curable. I'd get treatment, most likely antibiotics, and I wouldn't have sex until treatment is completed and that I know for sure the STI is gone. And I'd make sure to talk to my partner about it and have them tested and treated as well. And then afterwards, I would get tested regularly, and I'd practice safe sex. So if you have any questions about this presentation or anything sexual health related, please email me at education.fm@northreach.ca. Thanks for watching.